Hello, this is Nitin Kalra in the Department of Health Informatics at George Mason University. The topic of this presentation is sensitivity and specificity. This presentation was prepared as part of the HAP 671 course on healthcare databases taught by Dr. Sania Avramovic, PhD, at George Mason University, Department of Health Administration and Policy. These slides present the concept of sensitivity and specificity of a diagnostic test. When we talk about diagnostic tests such as MRI, blood sugar tests, or antibody tests for COVID-19, we want to know if the test we are using to diagnose a disease or a condition is a valid test. Is it truly good at separating people who have the disease versus those who do not have the disease? How do we interpret the results of the test? How would the cutoff limit affect how many individuals are ruled in to have the disease and how many are ruled out? Validity of a test is described in two terms: sensitivity and specificity. Sensitivity is defined as the ability of the test to correctly identify those who have the disease. Specificity is defined as the ability of the test to correctly identify those who do not have the disease. Let's take a look at an example that shows how to calculate sensitivity of an antibody test that decides if the patient has COVID-19 or not. Let's assume there are 1,000 people in our sample population and 100 people have COVID and 900 have no COVID. The test correctly detects 80 people with COVID to have the antibodies. So, the sensitivity of the test is 80 divided by 100 or 80%. The test correctly detects 80% of people who have the virus. Now let's use the same example and we see that out of 900 people who do not have COVID, the test correctly reports negative antibodies for 800 people. So the specificity is 800 divided by 900 or 89%. The test correctly identifies 89% of people as disease-free. So, if we want to lay out this example in terms of a formula, the sensitivity identifies the percent of true positives divided by all people who have the disease. True positive divided by sum of true positive and false negatives. Specificity identifies the correct percent of people who are true negatives divided by all people who truly do not have the disease. True negative divided by sum of true negative and false positive. We will now take a look at how the cutoff levels affect sensitivity and specificity. Let's assume that we have a population of 20 diabetics and 20 non-diabetics. Let's assume that blue circles represent true diabetics and red circles represent true non-diabetics. We have a test that can tell glucose levels in a person, and based on that, we have to decide which patients are to be categorized as diabetics versus non-diabetics. If we decide for a high cutoff level, then in this example, we see very few people qualified to be diabetics. There are many people who were diabetic but were not identified as diabetics. Hence, we have a lot of false negatives. In this example, the true positives are 5 by 20 or giving us a sensitivity of only 25%. But the specificity is 18 divided by 20 or 90%. So high specificity is reported. If we have a low cutoff value, we have many diabetics who are identified, so there is high sensitivity. In this example, we have 17 divided by 20 or 85% sensitivity. But specificity is a lot lower, only 6 by 20 or 30%. So we have a lot of people who are really not diabetic, but the test qualified them to be a diabetic. Hence we have a lot of false positives. This slide summarizes the effect of cutoff on sensitivity and specificity. A low cutoff results in increased sensitivity and increased reporting of false positives. A high cutoff results in increased specificity and increase in reporting of false negatives. What are the real life implications of having correct cutoffs for sensitivity and specificity? False positive results increase patients who need to be retested or treated and results in increased healthcare costs. It can also result in increased stress and emotional response on individuals. False negatives, in turn, can delay the treatment for diseased individuals, posing a risk for themselves or for society at large, especially in case of infectious diseases such as COVID-19. Thank you for taking time to listen to this presentation to understand sensitivity and specificity and its implications for healthcare.